Well, thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we welcome Dr. Neena Champaigne, who is a clinical associate professor and division chief of pediatric genetics at the Medical University of South Carolina. Thank you so much for being here with us.
Thanks so much. It's great to be here.
So this conversation could go for hours, probably, based on our pre-interview with you. We had so many things that just every time we thought we were about ready to start the show, there was another question that popped up. So I'm really excited to share this conversation. So I'm going to start by saying, first of all, you said that you're one of two biochemical geneticists in the state of South Carolina, and yet you formed this interest when you were in 9th grade. So I would love to just hear what drove you to, go on this path and become a doctor doing amazing work in such a small field that you're hoping does expand.
Absolutely. I mean, it's been an amazing journey. So starting, I guess, in my first exposure to genetics and biology in the 9th grade, we used to have those Punnett squares where we would look at and draw out, the potential risks for having a different genetic condition. And it sparked my interest from the outset. It was also in the time where there was a lot of discussion around sequencing the whole genome. And so to me, that was just absolutely fascinating that we could, unravel the code that makes us who we are and different in different ways. And so I started out my career knowing that I wanted to go into genetics, but never really understanding what the different avenues that could be explored within this field. And so when I was in college, I had the privilege of just going around and meeting with every different discipline. So I met with a medical geneticist and kind of got his perspective. I met with a genetic counselor, got their perspective, met with different people in both research and diagnostic labs, and then really just, landed on, I'm a people person. And so it seemed like a good fit for me in terms of my interest in genetics to go into that field. And I remember distinctly meeting with the geneticist at that time, and he told me I'd be an old lady by the time I was done. So that always stuck with me. And at that time, being in my early 30s did seem like it was going to be a long time but I completed all of my training in pediatrics and then subsequently in genetics. And so, have never looked back or regretted any of the journey. It's just a constant learning experience.
That's so inspiring, Dr. Champaigne. As I was telling you earlier, unfortunately, I tend to meet a lot of physicians who aren't as fortunate as you and have become really beat up and burnt out by the whole clinical process. And I find it inspiring the way in which you came into the field has probably been such a major reason for your continuing to find joy in it. So, I wonder if you have any more words of inspiration along those lines of, other people listening to the show, folks that might be thinking about whether to go into this field. What is it about this that makes it so interesting, and what's the reward for them in terms of meaning that they're going to find at the end of the journey?
Absolutely. I think, I share, some of the struggles of the day-to-day of being a busy clinician. But, I can say, I get up every morning, and even though I face, a challenging day, I always think about my patients and their families and kind of what they're going through, and know that, if they can do what they're doing, then I can continue and do what I'm doing and make sure that I'm there for them. I think a really good example, and we talked about kind of just sharing, what the reality of genetics means, today in the 21st century. But, one of my areas of experience and expertise and passions is in newborn screening. And so that's a space that I've been in for over 12 years. And so, one example of that really highlights that is, a new condition that was added to the newborn screening. So every baby in South Carolina, every baby in the US is screened for a subset of conditions that otherwise would not be picked up until they had some, symptom or medical crisis. And so in 2021, exactly a year ago, we added 2 different conditions. One is Pompe and one is mucopolysaccharidosis type 1, which is a mouthful, but they're both conditions where there's additional storage within certain cells of the body that over time accumulate, and they can have a number of health issues. So we were able to diagnose 3 different babies within our first year with Pompe disease, which, again, those individuals without detection would have storage material in their heart and do not survive past the first year of life. But when we pick them up, through newborn screening, we can start treatment with life-saving enzyme replacement therapy. And one of our babies, we were able to diagnose her and start her on treatment within, 2 weeks of age. And so she really, has done spectacular in terms of her response. And she's, a normal 4-month-old that, otherwise to look at her, you wouldn't know that she has this potentially deadly disease that, again, if we hadn't detected and intervened, would have, had a different outcome.
Is that something that now she'll receive that treatment for the duration of her life? Does she have a normal life expectancy with that, or is it correcting it completely?
And that's a great question. A lot of these treatments are not cures, and so it is a lifelong commitment. But it certainly has changed the quality of life and the natural history for both the patients and the families. And so it depends on the condition and kind of how successful we are. But we're in an age of genetics and genetic research where there are just so many potential therapies, including gene therapy, that are on the horizon and may, completely change the landscape for even, somebody who's on long-term treatment.
I just find that so profound, Dr. Champaigne. As you were saying, this is one of the newest specialties. It may feel to you like it's still going very slow, but just as a listener, I'm hearing what you're saying. And now, not only do you have a way to screen for these conditions, you also have interventions for these conditions. And in some cases, you've actually been able to make the screening throughout the state. So that is a remarkable story of access. I guess a question that I have related to that is that state by state? So South Carolina has now added these 2, but other states have to make a decision on their own?
Correct. So there is a federal committee that helps look at different conditions that have been nominated to be added. And it may be a parent, it could be a laboratory researcher that, has experience with a certain condition and they think that the condition's ready in terms of ease of testing, availability of treatment, and kind of the success for treatment. So that's a constantly growing list of conditions that, people are interested in potentially adding. In South Carolina, we're up to 55 different conditions, but every state has different resources allocated and capabilities. And so, compared to my home state of Texas, they have a very large population, they have a very large lab. And so sometimes adding tests is a little bit easier for them compared to a smaller state like South Carolina because of, staffing, resources, equipment. So there are some, nuances in all of that process. But again, there are federal agencies, including the CDC, Association of Public Health Laboratories, that help try to streamline that whole process so that there's, equity amongst, the different states. But again, as more conditions get added, it becomes a little bit harder to keep up. So, in my area, it may be a little bit different in Georgia or North Carolina. And so, trying to make sure that we are all, screening for the same things is something that we strive for.
It's also interesting because you told us before that, you can add these things and it can be a process to add them. But you said that there's also the interesting situation of, there's the human aspect. Some people want to know and some people don't want to know. So just because you can doesn't mean you always will. And right. So for you as somebody, how do you help people determine what really is necessary and possible? And how do you avoid people from looking at you like you're a wizard who just because you find this means that you can necessarily correct it? Because that's not the case either. So how do you balance that? It's a fine line to walk.
Absolutely. And I think we have to separate a little bit kind of the different situations. So, to our previous point about newborn screening, that's why it's so carefully vetted, at the federal level to really understand kind of the public benefits of early diagnosis and treatment, and trying to make sure that the conditions that are selected are ones that have a meaningful impact, and to try to prioritize the different conditions. On the other side, when we see, at least in our clinic, we have, a different variety of people who come to us that maybe have developmental delays or, birth defects, autism. Every family comes in, with a different perspective in terms of where they are in the process of trying to find answers. And so part of, our role as genetics providers is to walk them through what, the benefits and the risks and the limitations of genetic testing can provide to them in their, what we call Diagnostic Odyssey. And so everybody is at a different place in that odyssey. And some people, are ready and interested in getting information. Others, prefer to just kind of watch and wait. And again, everybody's preference is different. And I think as genetics providers, we really strive to respect, patients' and families' wishes and where they are in that journey, and just partner with them so that they can get the information that they need when they need it.
Yeah, Dr. Champaigne, one thing that's ringing in my head as I was thinking about your last response when we were talking about the states and access, and you mentioned equity, and I said, whoa, okay, well, we're talking genetics, and obviously that's linked to race and to culture, but we don't often talk about that. Now it's becoming more talked about, in general in society. So, is it kind of to be understood that you're taking that into account when you're thinking about which populations to screen for, making sure that all populations have an equitable access to the testing, and how do you kind of factor that into the equation in terms of how are you going to make sure that populations that may be vulnerable are particularly able to get access to some of the screening and the interventions that you're talking about?
That's a fantastic question, and something that we struggle with in terms of equity. In terms of the public health initiative, again, it's across the board. Anyone who's born in, any state is going to get that screen, which we think is a positive. I think some of the challenges that may come, that there may be a discrepancy in terms of access is, in types of insurance that, people may have, their access to different providers, specialists who can provide the appropriate follow-up. And we talked a little bit about, just getting the genetic test approved, can be a process, again, that could be different depending on a person's socioeconomic status. And then lastly, for some of these, and this is something that we have to navigate for families and parents, and it is different from state to state, is the ability to access the treatment. So these treatments, not only are specialized, but they can be very costly. And so that's another point where we do certainly find areas where there could be a difficulty in access. I will say a lot of the rare disease companies, pharmaceutical companies do make a big effort to make sure that people have access to the drug that they need or the treatment that they need. But there certainly are a lot of barriers that we identify along the way in trying to make sure that we're able to provide, the appropriate services.
How fortunate are the people that have access to you, that are living in South Carolina, and then you have this wonderful medical center and that's able to get people this level of service. And I wonder, in terms of vulnerability and equity, those people that maybe don't have access to such a health system, what is it that they can do? And I know that the options there may also be limited, but I think our audience will really appreciate just hearing you help them think through it. Anyone in our audience that maybe a parent of a newborn or about to deliver, or even a caregiver, what is it that you would want them to know about trying to help themselves or their patient patients get access to this kind of testing?
Absolutely. So in my experience, parents and families are fairly savvy. The internet or, online resources have certainly expanded and try to ensure that people have access to, the different networks of providers that are available. In the newborn screening space, for instance, there is a website called Baby's First Test. It's a federally sponsored website, and it actually logs state by state what the different conditions are, who the providers are, gives fact sheets. So it really serves as a clearinghouse for people to access information specifically about newborn screening. Beyond that, there are actually regional genetics groups. And so I didn't mention this, but I'm the president of the Southeastern Regional Genetics Group, which encompasses the states all the way from Louisiana over to North Carolina and Florida. But there are 7 different genetics groups. And so each website has kind of their own regional network. So patients can log in or providers can log in and see what providers are in their area and how to access them for services. So those are 2, again, federally funded resources that allow for people to at least see what is in their area. I do know, again, because there are not many of us, there are some states that don't have a biochemical geneticist. And so they have to, work with their surrounding states in order to make sure that they have adequate access and coverage. But those resources at least allow providers and patients to see where those providers are, and in some cases what their level of expertise is, or maybe specialty areas and access from that point.
As people start this journey on genetics overall, what is the message that you would tell to people in general who are doing that, patients, and then the message that you would give to doctors just beginning this journey as a geneticist?
Oh, that's an interesting question. I think, people, although we're getting into an age, I think, because there is so much publicity around direct to consumer testing, you have a lot of advertisements for things like 23andMe and Ancestry.com, and people, are interested in that. So I think it's highlighted, the role that genetics can play, for an individual and their health. And I think, just the awareness that, there is a specialty within medicine and that there are a variety of genetic providers that can help navigate that process, when you are concerned, either because of your family history or a current diagnosis or concern, to make sure that we can help navigate that process for diagnosis and management. So I think, just recognizing that we are kind of a service that is slightly different and do specialize in this very unique area. Certainly there are a lot of different providers that have that background. And for providers, I think, trying to ensure that through all sets of, their training, that they get exposure and continuing medical education about the ever-changing landscape of genetics, not only in terms of, diagnosis and testing, but also these treatment options. And even those that don't have treatments, just being able to understand that an answer and a diagnosis, because I hear that a lot. So you can't change your genes. So, you get a diagnosis, what can you do about it? A lot of it is around kind of that anticipation and that healthcare roadmap that you can now provide a person and a family based on that information, and even putting them in contact with other individuals that have the same condition so that they can use them as a social support. So there's a lot of benefits, again, from testing that, people, I think, should be aware of.
Thank you so much. This was fascinating. I learned so much.
It was a pleasure. And like I said, I could go on and on because I absolutely love what I do.
Well, thank you so much for being here. And thank you all for watching. We'll talk to you soon. Bye-bye.